y'all hear me in the back? That's on? Okay, great. Just a couple things before we get started. How many people have chemotherapy survivors or cancer survivors here in the room? How many professionals? Great. Okay, and then of those who've had chemotherapy, who has had chemo brain? Anybody know someone with chemo brain? Yeah, anybody think you know someone with chemo brain? All right, well, I like to say that I've recovered fully, but that will be up to you to determine if I still have cognitive deficits. So we'll see. The purpose of today's session is to give you the recent findings about the brain in general and about how our concept of the brain, many of us, most of us here are over 25, and our knowledge of the brain has changed so much in the last 10 to 15 years. So I want to give you a bit of an overview of that, talk about my own experience with cancer, with recovery. Even though I'm a breast cancer patient, there's so many commonalities. And my experience with speaking with lymphoma patients is that they have some of the most severe symptoms of chemo brain, equally, if not more so, than breast cancer patients. But I want you to be empowered today. So I want to answer your questions. I want you to understand that there is a method for you to recover, or your patients to recover. And we'll talk about that, and if you can save your questions until the end, unless it's just so burning, I can take it, I can handle it. But you can hold it to the end, that would be great. And in the very back of the room, I took over a table back there. I have an email mailing list. If you'd like to be on my email list, it will come out about once a month. I don't give your data away to anyone. And then there's a handout on the diet suggestions I have for you as well. And if you want to take a little survey about how much damage you might have if you think you've had chemo brain, then that's also included there as well. Okay, I am a stage 3 breast cancer survivor. Sometimes when people see me, they'll think, oh, you must have had stage 1 because you don't look like you've been through very much. But I just want to tell you about my journey a little bit.